Good afternoon, everybody, and welcome to our webinar on affordable, accessible housing and community living policy. This webinar is hosted by the Community Living Policy Center, and all slides and the recording will be sent out to attendees in an email after this webinar. So please know that you will have the slides and recording after the event. Just a couple of logistics before we get started. An overview of today. We will be talking about, again, affordable housing and community living policy and how these two intersect. I'll be introducing today's speakers. After that, we'll be hearing from Kartik about understanding housing and neighborhood inequities. We'll then hear from Lou Breslin on her case study on a housing program called Oak Days. And then lastly, we'll hear from Mike Oxford on housing policy and what this really implies for community living policy. We'll have a chance for question and answers at the end. I encourage everybody to ask questions through the Q&A box on, it should be on the bottom of your screen in the middle. And then as well as the chat box. So you feel free to use the chat box to ask questions as well as we move through the webinar. The Community Living Policy Center receives support from the National Institute for Disability, Independent Living, and Rehabilitation Research from the Administration for Community Living. I mentioned kind of how to use the Q&A section on the bottom middle button of the screen. You can always turn on the closed captioning if you hit the closed captioning button on the bottom right-hand corner of your screen. I'm really excited to introduce today's speakers to you all. First, we have Kartik Trivedi, who is a policy researcher and current PhD student at the Heller School of Social Policy and Management at Brandeis University. His research work has focused on housing disparities and labor market disparities that affect people with disabilities. His dissertation work focuses on algorithmic fairness and inclusion of people with disabilities. Next, we have Lou Breslin, who currently serves as a senior analyst and researcher within the Disability Rights, Education, and Defense Fund, a leading national disability rights law and policy center. She focuses her advocacy and research on policies affecting equitable access to healthcare, including durable medical equipment, long-term services and supports, and affordable, accessible housing for people with disabilities. And lastly, we have Mike Oxford, who was a consultant for CLPC. Mike has been active in the independent living movement since 1984 and recently retired after serving 25 years as the director of the Topeka Independent Living Resource Center. Mike has served on numerous boards and is currently on the board of the Partnership for Inclusive Disaster Strategies. He has also been active with ADAPT for over 30 years. We have a really great panel today discussing their work with you all. And so I'm going to hand it over to our first speaker, Kartik.
Good morning, good afternoon, folks, wherever you are. Thanks for joining in. Can we go to the previous slide, Teresa? This is a great setup because I'd be talking about broadly about the macro, about what housing inequities are out there, and then we will have case studies and then the policies. So my first presentation would kind of orient you to what are the challenges at the housing for people with households with people with LTSS needs. And I don't want to keep you in surprise. So here are the findings. Households with disabled members, and especially those with LTSS needs, do not have it good. They are in position, they are in households where most of the time they are unable to pay. They are at higher risk of being in neighborhoods which are of poor quality. The houses that they live in require severe upkeep issues and structurally deficient. And they do not think that their neighborhoods or houses are good. And finally, all of that is happening with higher relative housing costs. So that's the summary. We will go into details. I will be talking about more specifically how do we define, how do we define different variables and our model. Teresa, next slide, please. This presentation is based on the work that I've been part of with Tatiana Meshte and Joe Caldwell. With the slides, here's the link for the paper, and you can read it. All the citations that I have in the presentation are also part of the paper. So I'd highly encourage you folks to take a look at that paper and get into the more of the details and the nitty-gritties of how we are defining and what we are finding and what it all means. So now on to the next slide. Now, like any presentation that we do, what we kind of have to build up is the argument that why is this thing important? And what we know is that that housing is, yes, that's the slide. Is it automatically moving, Teresa? It's so yeah. So housing as a social determinant of health. Housing plays a significant role in the lives, in everybody's life, and it does so more for people with long-term services need for LTSS. So that, and we are talking about a significant portion, a significant group of people in our country, which is not only important in terms of what they can contribute to the society, what they are, who they are, and in a more economical sense, and when we think about the economics of it, these are 14 million people, and wherein government is spending some change on LTSS services. So means if we purely look at it in a human side of things, this anybody is important, and this population is definitely so. So that makes the reason why we are focusing on this population. On the next slide, we will see that why housing is an issue. And what we know is that housing determines so many things. It determines health, it determines financial well-being. And in fact, with regards to financial well-being, it's kind of a bi-directional relationship, wherein if you are in a bad house, you would probably face more financial hardships. And if you have financial hardships, you will most likely be in a situation where a housing situation is not up to the mark or is not satisfactory. So, and then housing is also important for physical and mental well-being. It's a place where you feel comfortable. It's a place where you get to invite people and be with community. It's a place of engagement. And the research that you see over the years kind of points towards that. And sadly, it also points to the fact that households with members with disability are more likely to live in housing with a poor quality indicator. That means their housing is substandard in terms of construction and quality, and also living in a bad neighborhood. So what we see is that there are, means before I started with this research, there were already signs that it might not look good for housing needs for LTSS households. Now, looking more so at housing as an issue, one to the next slide, please. Just to sum it up, good housing is a source of dignity. And it's not a unidimensional issue. And I think other presenters today would kind of also bring this attention to this dimensionality and secure housing and security, which can be defined, and at least in our paper, we define secure housing as something that is accessible, that is of good quality, livable, um, is important. So, and secure housing kind of ensures long-term health and long-term participation in community. So with that, we get into the more detailed part of the work that we did and the paper that we built. And on the next slide, I will kind of bring your attention to the affordable housing part of housing security. So when we think about housing security, we want to think about how affordable it is. And what we know is that almost 27% of people with disabilities are living below federal poverty line. And what that means is that uh, for any housing cost, it might kind of breach the 50% portion of what money or income that they're making. So that, and 20% of households that receive rental assistance from HUD include people with disabilities. And these are statistics, but what it all translates into is that there are higher financial burdens just by having a person with disability in your household. Chances are statistically that you are at risk when it comes to housing. Uh, and disability households are also at higher risk of homelessness. Now, when we talk about homelessness, it is again a multidimensional issue, given that what kind of housing uh, or housing tenure was, whether somebody was renting, whether somebody was owning, whether they were able to meet their obligation, whether rent or debt obligations. So that is the whole affordable housing in a slide, what it all means. Onto the next slide, what we will see is the housing quality. And this is something which, again, I want to draw the attention. When I'm talking about housing security, these are the conceptions of context, they're contextualized within the paper. So normatively, they can mean more, but we are going with somewhat of a narrow definition. So when we talk about quality of housing, we are talking about structural deficiency. We are talking about whether there are exposed wirings in house, whether their walls are chipping, paint is chipping, there are holes in ceiling or walls. And throughout the research and even through American housing surveys and census own research, we know that for people with disabilities, the indicators of housing quality are not good. The amenities, just the number of amenities are lower for households with people with disabilities. And what we also get to see is that the overall stock for housing stock for that constitutes accessible housing is small. It's not enough to meet the needs of the people out there. And finally, what physical and structural deficiency lead to is that people have to pay more money to make their house livable. So what we already saw in the affordable housing slide is compounded when we look at quality of housing as an issue. So we already see kind of layering up of issues that are both make more financially onerous for people with households with people with disability or households with LTSS needs. Finally, in the next slide, we see that it's not just about structure, it's also about where you're living. And neighborhood plays a big role in our conception of housing. You do not just live on an island, you live with people. And what we see is that disability households are more likely to be in less desirable neighborhoods. What that means is, or what that translates into is a neighborhood where there is a high risk of petty or serious crime, high risk of natural disasters. Um, and we also see throughout years of American Housing Survey that people with disabilities are more likely to rate their neighborhoods poorly than people without disabilities. And so finally, the picture that sums up for us at least for broadly with when we talk about people with disabilities and the households, is that first they have to pay more to the house to live in a house. Second, they have to pay more for their maintenance because they are often uh, living in houses with poor structure. Again, they are related. And we also see that all these houses are not in the good neighborhoods. So this is kind of compounding of issues one over another. Um, so where does that leave us? And in our work on the next slide, from the next slide, we get to see that uh, we need to address some gaps. We know things about housing quality for households with people with disabilities, but we do not know much about what it means for households with LTSS needs. We know about housing accessibility and households with people with disabilities. But again, for people with LTSS needs, for households with LTSS needs, we do not know much. We also know that tenureship, by that I mean whether somebody owns or rents a place, has an impact on what kind of house you're living in when it interacts with whether somebody with disability lives in the house or not. And then finally, we see that there's this positive association between adverse housing, adverse neighborhood features, um, if there is a person with disability in the household. So these are the gaps that we need to explore and understand, and what it all means for households with LTSS needs. On the next slide, please.
Excuse me, Kartik, we have a question in the chat asking about what you mean by undesirable neighborhoods.
What I will do when I'll try to incorporate an answer in my slide. So when we are looking at the gaps, we want to kind of see into housing security for households with people with disability, with long-term support and services, and housing and neighborhood quality community living for households with people with disability. So that's the gap that we want to fill in this paper. And as we go to the next slide onwards, we kind of I'll try to explain the methods or things that we do and how we are limited by nature of data. So to answer that question from the next slide onwards, I will get to that. Well, we can only answer based on the data set that we have, and what it means for housing quality is limited by what we have in data. What we mean by desirable or undesirable neighborhood is what we have in the data. So the next slide, please. I kind of talked about it. We want to kind of compare housing security between LTSS disability households and non-LTSS disability and non-disability households. So we would be following kind of a logistic regression and compare these kind of households. And so what I mean by LTSS disability households are households with any member with long-term support services needs. Non-LTSS disability households is an household with a person with disability who does not have an LTSS need. And then finally, non-disability households are households with without any person with disability. Next slide, please. So our data source for this is American Housing Survey. And the key variable is the independent variable, that is disability category. So for LTSS households, we look at households with individuals who report difficulty doing errands and taking self-care. For non-LTSS households, we only kind of group households with one or more members with any disability other than self-care and independent living difficulty. Non-disability households are households without anyone with disability. And our conception of LTSS household is we also check our conception with other data sets in terms of population proportions. So what I mean by that is we look at population proportions through our conception of LTSS household and that of other data sets, and they were pretty they matched pretty nicely. So that means that we are getting it to the right population groups through our conception of LTSS household. Then for dependent variables, housing affordability indicators, a few of them that are list, housing quality indicators, and then neighborhood quality indicators. So there are three constructs. And one of them in the neighborhood quality indicators is whether neighborhood is desirable or not, whether they like to live in that neighborhood or not. So that's a question that is part of American Housing Survey, where the survey asks householder whether you like your survey or not, whether you like your neighborhood or not, and they respond that on a scale of 1 to 10. So when they say for any of the questions here, which talks about desirability or quality of their household or neighborhood, when they say that it's less than 5, then we say that it's less desirable, and then it's more than 5, then we call it more desirable. So that's the answer to the question. Then finally, the analytical method, as I mentioned, is a logit model for each of these quality indicators. And then we adjust that for demographic and socioeconomic indicators. On to the next slide, please. These are the general demographic distributions that we can see for households. What I want to draw your attention to is that there is a difference in households with people with disabilities and LTSS needs, with more female householders for LTSS households. And on to next slide, where we will look at age distribution. It is not surprising to see that LTSS households are tending towards more older age than households without people with disabilities. So that's a key difference that we see. So the age is kind of correlated with the presence of presence of a householder with LTSS needs. So onto the next slide, we see race and ethnicity as a demographic distribution. I think these are the three main demographic distributions that I wanted to share. And we do not see much difference. And we also checked for that in our analysis. And this is important because race is an important factor when it comes to housing in the US. So we needed to include that. We needed to see how that interacts with our disability household variables. On to the next slide, please. In terms of control variables, we control for householder age, race or ethnicity, marital status, education status, tenure type, presence of elders in the household, geographic indicators, whether the household is in metropolitan or non-metropolitan area, and which region, census region is the household in, and the total household income. For just to be sure that household income was not used as a covariate for housing cost burden indicators in our regression. So on to the next slide. So here is the comparison. The numbers that you see are the odds ratio for our logit analysis. On the x-axis, you would see that we have all the indicators. So the first indicator on the x-axis is housing cost above 50% of the income. Second indicator is behind paying rent or mortgage. So they are not able to meet their rent or mortgage obligations. Then we have 3 housing quality related indicators. That is, house requires severe upkeep, inadequate housing, low housing quality. And then finally, there are 3 neighborhood quality indicators. What we see is that odds and anything above the line that you see at 1 means poor quality or bad. And anything less than 1 would be a good thing to have. And what we see is that for adjusted odds ratios, just the blue dots that we see, it's all bad for disability household compared to non-disability household. The odds of being in a high cost housing are more. Same for all the variables, and more so for upkeep problems. So for people with disabilities, the households with people with disabilities who are living in houses, they require higher upkeep. And that is by the factor of 2. So it's quite high. This picture kind of continues onto the next slide, where we kind of look specifically for the LTSS or households. And here's the most interesting picture, where if you look at the gray triangles, which are the odds ratio for households with LTSS members, we see that for most of the indicator, they are worse off than even people with, households with the people with disability, person with disability, that is a non-LTSS disability household. So an LTSS household across the spectrum of indicators are worse off even from the household that have just a member with disability, that is a non-LTSS member. And that was a serious finding for us when we saw, and especially looking at the upkeep issues, looking at the housing quality and neighborhood crime status. That meant that we need to have a policy response that is more targeted for LGSS households. So on to the next slide. This is the, I don't want to bore you, but this is the more detailed table. I would highly encourage you, if you don't get time to read the paper, do see this slide deck and look at the exact numbers. And this has all the information that I've presented. But in summary, and on the next slide, there are serious implications now. Community living is a cornerstone. We know that. There are efforts, but we are not meeting the needs. That's what we have found. And it is essential for us to start doing things so that we can meet the need for this population group. And I will take more questions at the end. So thank you, folks. And over to Teresa or Mary Lou.
Hi, everybody. This is Mary Lou Breslin. And thank you all for joining us today. So I'm going to be talking about a housing plus healthcare and supportive services pilot program in Oakland, California, that I investigated as a possible promising practice. This two-part pilot is called Oak Days, and it came about because the COVID-19 pandemic accelerated concerns about unhoused people who weren't able to quarantine or shelter in place. So using the federal COVID relief funding, the County of Alameda, which is east of San Francisco, for those of you who aren't familiar with the California geography, purchased a vacant hotel where about 140 unsheltered people who had been living in encampments were housed so that they could shelter safely in place. The intent was to create permanent supportive housing when the pandemic waned. So as people moved into the hotel, public health leaders recognized the high prevalence of disability and extreme health problems that residents were facing. In response, they launched a program of voluntary on-site health care for all the residents. And I think really notably, in terms of the case study, they were offering and providing personal care services along with case management and other supports for about 40 residents whose significant functional limitations and very complicated health conditions made them eligible actually for institutional levels of care. The goals were to improve health and prevent deaths, but really most importantly, they were hoping to ward off institutionalization. Next slide, please. So let me just place this pilot in context for a minute. This is specifically relevant to the California area. We know that about is close to 175,000 people now don't have a place to live in California. And homelessness is obviously driven by many factors, including high housing costs and particularly on the West Coast, severe long-term underdevelopment. It's also an outgrowth of the impacts of structural racism and intergenerational racial inequality. And some of that, the impacts Kartik just pointed out in his presentation. A number of studies have tried to explain why so many people are unsheltered, but really the most recent research suggests that the combination of rental costs and vacancy rates are the highest predictors of rates of homelessness across the board in virtually every city. A very recent study looked at West Coast cities and basically in comparison with cities such as Miami, Dallas, and Phoenix. And what was learned is that there's a direct relationship between affordability and availability of housing and levels of homelessness in all of these locations. They're higher where there's less availability and higher cost. They're lower where there's more availability and lower cost. Next slide, please. So the severe housing shortages that leave low-income people really priced out of the commercial market. In Alameda, for example, where the Oak Days pilot is located, there's only about 25 affordable units for every 100 very low-income households. That's a fairly standard figure, I think, in most metropolitan areas around the country. The county estimated that about 5,400 more affordable units are needed to meet demand. And obviously, if for someone who's on supplemental security income, that payment is really only will only cover about half of the market rents for a one-bedroom apartment. The state also suggests that there's probably about 700,000 people on wait lists for rental vouchers. Next slide, please. So the COVID-19 pandemic spread against this backdrop, creating a crisis for unsheltered, sick, and disabled people, especially people of color. During the early days of COVID, the estimates are that about 7,000 people, it's a lot of people, were unhoused and living in encampments. And about 2,600 were living in temporary overnight congregate shelters, but were on the street during the day. Public health officials were obviously aware of these numbers before the pandemic, but they're really no less shocking. I think it's important for those of us on the webinar today to recognize that about half of the people in both living in overnight congregate shelters and who were unhoused had disabilities of some kind, and about 18% had 3 or more disabilities. Almost 70% were people of color, which is the direct outgrowth of structural racism, and 43% received either SSI or SSDI. None of these folks were able to shelter in place safely. Next slide, please. So just to illustrate the point, obviously, I think any of you have been following the experiences of people who are unsheltered. This is not an uncommon sight, but this is a photograph of an encampment in Oakland, California. And these encampments are widespread across most urban areas in California. We see tents, shopping carts, and personal belongings strewn along the roadway. Next slide, please. So through the early days of the pandemic, many cities around the country were moving unsheltered people temporarily into hotel rooms. California's programs to safely house unsheltered people were called Project Room Key and Project Home Key. Some cities and counties, including Alameda, also purchased vacant hotels to house people temporarily using 2020 CARES Act pandemic funding. In some cases, the locales intended to convert those hotels to permanent supportive housing, which typically pairs ongoing rental assistance with some kind of in-house services. So as people moved into various hotels in the area, the public health leaders observed serious extremes, people with multiple complex illnesses and mobility limitations, untreated wounds, mental health and substance use disorders, malnutrition, terminal illnesses, behavioral issues, and so on. So they saw an opportunity really growing out of the pandemic. Next slide, please. So I've just included a quote from one of the senior program executives that I interviewed as people were coming into the hotels from the encampments because it paints such an incredibly stark picture. So this person said that, and seeing people come in off the street was unbelievable. Just the level of acute medical and mental health needs. We had people coming in who couldn't walk, didn't have wheelchairs. We had people who had no way of moving. We had people who hadn't showered in years because they didn't have access to a shower bench or had incontinence but had no supplies. And all of these things just like that. How did this happen? Let's not even talk about consistent medication access or storing your insulin. So the lack of access to consistent basic medical services for unhoused people is significant. And you're wondering, how does this person get here? How are they alive? So even as people were in terrible shape physically and psychologically, their relationship with the various siloed care delivery systems were also fraught. They circled through emergency departments, inpatient psych facilities, nursing facilities. One of the senior administrators we interviewed disclosed that some people in the care system referred to them as impossibles. This person went on to say it's a very loaded term because that's the label. that the delivery system imposes on them. Really, they highlight an epic failure of our delivery system to support individuals who have this particular set of needs. I would contend nobody is impossible. We're all just human. We bring our own unique set of conditions. It's just simply that the system is so shockingly ill-equipped to provide for individuals with this particular set of needs. So next slide, please. To the public health team that envisioned Oak Days, wanted to create permanent affordable housing with culturally aware and competent services and supports that were trauma-informed and that valued harm reduction principles and honored housing first principles. That means participation in services being offered was entirely voluntary and interactions acknowledged and deferred to person-centered preferences and values and goals. The overarching whole person paradigm would support health, personal goals, and community inclusion. And it would do everything it could to ward off institutionalization. So their idea was to braid together various Medicaid funding streams so the whole person could be supported where they were as their physical and mental health and personal care and other needs changed over time. So next slide, please. So by the spring of 2020, Oak Days, a Days hotel had become Oak Days with about 138 residents with varying health needs. About 40 of them needed immediate medical care, personal care services, DME, prescriptions, hospice, care coordination, and more. In combination, these health and personal care needs meant that these 40 individuals met individual institutional level of care requirements for various Medicaid waiver programs. Oak Days leaders set out to stabilize their health and stop the cycling in and out of emergency departments. They also really primarily were doing everything they could to keep people out of institutions and in their own homes. Operationally, Oak Days was originally classified as a COVID shelter, but even so, residents controlled their own rooms. They could come and go as they pleased. Meals were provided and transportation was also available. People with significant mobility limitations were given ADA accessible rooms. Residents that we interviewed were happy with the situation that they were living in at Oak Days, with the main complaint being that there were COVID restrictions in the early days, which they felt were too limiting. But those restrictions were intended to prevent the spread of COVID. So next slide, please. There's 4 primary partners involved in the Oak Days project. What is called Cardia Health, which is a nonprofit founded by the Oak Days leaders that provides management, healthcare staff, personal care services, skilled nursing, and other primary care. A second participant is an organization called 5 Keys, and they provided meals, security, and other services on site. What's interesting about 5 Keys in particular is they brought cultural awareness to the hotel and to the residents, largely because they had lived or adjacent experiences similar to those of residents, including substance use disorders, homelessness, and or justice involvement. Third partner was an organization called East Bay Innovations, who for about 30 years has helped people transition from institutions and supports people with disabilities to live independently in their own homes. They provided case management and helped residents apply for Medicaid, personal care services, and they helped recruit and hire personal care workers. The County of Alameda also played a big role by letting the contract with 5 Keys, and they provided early gap funding for on-site personnel, including health and personal care workers. And of course, they purchased the hotels with federal and state funding. Next slide, please. So there's a wide range of healthcare and other services were offered to residents, and they could accept them or reject them as they chose. Let me just give you a quick example here, just to illustrate sort of the situations that people found themselves in. This is a quote from an interview that I did with one of the staff members. A resident had been paralyzed from the waist down due to a gunshot wound for the last 15 years. He had extensive and profound pressure ulcers, on his backside all the way down to the bone, essentially unstageable, that extended all to his toes. They recommended amputation due to chronic osteomyelitis. He refused the amputation. He also has a constant urinary tract infection. He's got a pretty profound substance use disorder, and he'd recently overdosed in his room, and it took 3 rounds of Narcan to bring him back to life. If the clinical staff had tried to force unwanted care on this person, he would have left and returned to the streets. That would have accelerated his health problems and further shortened his life. He wanted to stay at Oak Days. He didn't want to go anywhere else. And so they supported him by providing stable housing and non-medical services and personal care. Okay, next slide, please. So the funding for Oak Days comes from 4 basic sources: Medicaid home and community-based alternatives waiver, which pays for up to 24/7 personal care if needed, some home health, nursing, case management, and so on. Healthcare was provided through California's Medicaid healthcare program called Medi-Cal. Medicaid in-home supportive services also paid for self-directed personal care services up to a maximum of 283 hours a month. And the Alameda County provided some initial funding for medical direction and site administration, and obviously for the purchase of the hotels. A little bit of temporary funding was provided by another Medicaid pilot called Whole Person Care right at the beginning of the program. Okay, so next slide, please. So what kind of successes and challenges can we report from this program? Most of the initial 40 residents in the pilot chose to remain at Oak Days as it is being converted currently to permanent supportive housing. 3 people were helped to move into apartments, and 2, possibly 3 others died at Oak Days from cancer and chronic conditions. The residents, from the staff point of view, were stabilized medically. The Cardia Health, the organization that was providing healthcare, took a look at utilization for the 6 months prior to people coming to Oak Days and 6 months following their residency there, and reported that they found emergency department visits were reduced by 72%. Inpatient admissions were down 71%. Nursing facility admissions were reduced by 84%, and use of emergency psychiatric services were reduced by 89%. They also found that there were even greater improvements for the initial 40 residents who received the highest level of care. So just next slide, please. So just summing up the pilot's challenges and successes. 60 people are now participating in the pilot. This is since we concluded our interviews with the staff and the residents. 30 others are also receiving the same level of supports and services at another second hotel site. Currently, Medicaid funding is covering all the costs, and theoretically, the program can be replicated. The leaders have created a playbook for other locales that want to adopt the model, and San Francisco, for example, has expressed interest. There's some real challenges, I think, specifically for the replication. Because this is a 2-pronged model, the availability of housing still remains a question mark. COVID unleashed a lot of funding very quickly, which made purchase of the vacant hotels relatively easy. But creating or identifying housing at scale that's needed really to solve both the problem of people who are unsheltered depends on a lot of complicated factors that Mike will be talking about in a minute, and that Kartik mentioned as well. Obviously, financing partnerships with other providers, et cetera. New affordable home construction is really difficult and time consuming, adding an additional barrier. The Oak Days leaders are envisioning that these services and supports can be provided in other situations. You can take a look at the slides to learn a little bit more about that. So I'm mindful of my timing. So I'm going to just wrap up here and just say that more in-depth research is needed to understand the long-term impacts, especially the extent to which the pilot helps people stay out of institutions and permanently house long-term. But so far, it's proven to be a very successful model that is beginning to make a dent in the situation that people who are unhoused are facing here in the Bay Area. So let me just conclude and hand it over to Mike.
Mute, video. There I am. Thank you, Mary Lou. Boy, it's going to be hard to go after anyway. So hi, everyone. This is Mike Oxford, and I'm glad to be here. I've been a long time part of the Community Living Policy Center, and I guess I should say too that more recently, even though I retired, I'm the acting interim director of the Atlantis community in Denver. And since I've been there, I just want to say housing has been the biggest issue. And it's boy, it's just really, I'm from a rural area. It's hard for me to wrap my mind around, but all the stuff, Mary Lou, that you're saying, and Kartik too, is just right there in front of us. And we keep coming back to, there's just not enough of it. So that's going to be one of the themes I want to follow there. But first, with getting started, I do want to recognize that I'm in an eastern part of Douglas County, Kansas, and I'm sitting on stolen ground. So this is for thousands of years, Kanza, Osage, Wichita, Kiowa, Apache, Comanche, Pawnee, Cheyenne, and Arapaho, and other nations land. And so that's next slide, please. I think it's just important because all housing and homes is all in a place, and knowing where these places are and who has benefited and who has been screwed is important as we move ahead. So speaking of land appropriation, though, I want to talk a little bit about the whole notion of public housing and sort of public assistance for housing in the US. And really, I think in the biggest way, it starts with the New Deal, with the Public Works Administration in 1935. The very first public housing project involved evicting Black folks from their housing and their places, and then converting that into 600 and some odd units in segregated white-only housing. And that has been, as both of our previous speakers have said, has been a continuing and existing issue to this moment. So this continued through. There was a Housing Act of 1937 that was mainly aimed at clearing slums and for jobs. But citizen activism and so on really added a component of beginning to look at housing as sort of a human right and as a social good there. So, however, the segregation continued. In 1954, I didn't put this on in the slide, but another watershed date, Brown v. Board, and basically where there was an opportunity maybe for the Eisenhower administration said, yeah, separate but equal is no good anywhere, actually issued, literally papered over that issue and put out a paper that that didn't apply to the Housing and Finance Administration. And so the segregation continued on through, and then finally the Fair Housing Act in 1968 had some teeth, didn't cover people with disabilities yet. And then a few years later, by 74, the Nixon administration put a moratorium on funding for public housing. That continued. President Reagan cut more, changed the focus from bricks and mortar kind of housing and public housing to the sort of voucher system that we're seeing today there. And then just another big thing was the Hope 6, again, was meant to renovate dilapidated public housing and so on. The problem was it was a way big overcorrection. The amount of dilapidated housing wasn't that high. And so a lot of public housing was eliminated and never put back at the same affordability that it was before. And finally, where we are now is the vouchers, which a lot of us have been part of targeting different groups with different needs that we're seeing, and that's kind of grown. And I applaud HUD and so on and policymakers for making use of what we have, but it really feels like we're slicing the bean into ever smaller slices. And the whole problem is that one bean is not enough, and we can slice it all we want to, and it still won't be enough. as we parse that further. Next slide, please. So another thing that I just saw recently here is a paper from the Urban Institute and the Kelsey entitled "People with Disabilities Living in the U.S. Face Urgent Barriers to Housing. Federal Programs Are Not Meeting the Housing Needs of Disabled People." And it's from, I think, October of this year. Yes, October 22. So it's got a good overview and a ton of information. It's along the same veins that we've heard from Mary Lou, from Kartik, and that I've tried to mention some. But it looks at the different kinds of programs that we have and what's going on. Some of the findings that I think are real interesting is that 18 million people with disabilities in the U.S. are eligible for federal housing assistance, but aren't getting 18 million. Only 16% of low income receive any federal housing assistance. If we go up to the very low and extreme low income area, it goes up slightly to 21%. Median income for households with someone with a disability, again.
Mike, this is the interpreter. I'm sorry. When you look, I think you're looking at your notes, your voice trails off. So if you could just stay right where you are, that helps. Thank you.
Sorry. Apologies for that. Yes, that's exactly
all right.
what I did.
That's all right.
Again, real fast, 18 million people are eligible for federal housing assistance, but aren't receiving any. Only 16% of people at the low income level are receiving any assistance. It goes a little higher to 21% at the very low and extreme low income levels are receiving some assistance. Median income for families with a disability is only 6% of those without a disability, and so on. And what I found astounding too is we need to keep in mind these numbers from this study do not include people that are unhoused, people in institutions, or people in carceral settings, which we know, again, we just heard how these settings also include a lot of people with disabilities that aren't necessarily showing up in these kinds of federal housing needs. So next slide, please. And so again, here we are, some of the same information, perhaps put differently. So accessible and affordable housing are mostly found in public housing and other federally funded housing. The Section 504 requirements only apply to federally funded housing. So for instance, the 5%, 2%, 504 requirements, and these are requirements that say in federally assisted housing that 5% of the units need to be multifamily housing, needs to be 5% accessible to people with physical disabilities and 2% to people with sensory disabilities. But again, this only applies to a small proportion of the total housing in the country. And furthermore, we know that those percentages are too low. A friend of mine from Philadelphia has reported that their statistics indicate the Philadelphia numbers would be closer to 20% and 8%, or 4 times this bottom line need. So as long as this stays, every time a federally funded multifamily project gets built, we're falling further and further behind of the actual need, even though these requirements are there. And so we've been arguing with policymakers that it needs to be data driven, that we can get census data and other kinds of data and get more accurate numbers that reflect the actual need for accessibility. Another point, again, is that the Fair Housing Act amendments, which I didn't mention earlier, of 1988, which added disability to the Fair Housing Act, do not apply to the big majority of all the housing stock in the US. Single family homes, buildings with fewer than 4 units, and townhomes. Next slide, please. So most available and future housing continues to have no access requirements. Affordability is an increasing problem. And again, this remains one of the largest barriers reported from people that want to move from facilities to their own place or staying in the community. And I can tell you that my experience right now today with Denver, where all morning I was on the phone about numerous housing issues. And it's very, very true there. Next slide, please. So we've moved to vouchers under the Reagan years. And these alone are not the answer. I think we know now that they're not going to be the answer. I mean, I put it real simply, a voucher is not the same thing as a roof over your head. And again, this has been mentioned prior speakers. So vouchers, you know, were good for what they did, but the notion overall of sort of like, I don't want to get too political, but of the Reaganomics sort of like, you know, putting the resources in the hands of potential tenants, and that would create demand for exactly the kind of housing that's needed, simply has not worked because of the number of people with disabilities at the extreme low income and very low income levels without massive subsidies all the way through from development to construction to paying rent. It's just not profitable there. Also last year, working with HUD, they reported that there were slow uptake of almost 19,000 vouchers. So this means that actually a whole lot of people all over the country had advocated to get vouchers, but they weren't being used. I'm not really clear exactly on what all the answers are, but it did have to do with COVID and just providers and assistance and things slowing down. But it also had to do with housing, you know, just the barriers in finding housing. There were other things, workforce issues are growing too, along with housing. And I think the issue got mostly resolved, but I think how that happened was that those vouchers were redirected. So these are vouchers that had options, like you could target them towards unhoused people, you could target them towards people with disabilities moving out of institutions and so on. And so I think a number of these vouchers went from kind of one category to another in order to use them. But again, just because we have vouchers doesn't mean people are getting housing necessarily. And that seems to be an issue that's becoming of more concern. Again, voucher holders in high cost areas having difficulty, even though there are exceptions where if you are in a high cost area like that to like get some extra oomph to be able to find a place, it's not widely known. And frankly, landlords on the private sector can make more money with less hassle. And so that's also, you know, driving some landlords, again, to not accepting vouchers because of relative costs of housing. We need to spur production and increase availability across the board of everything. Housing is a money we need to throw a lot, is a problem we need to throw a lot of money at. And make it as usable for as many people for as long as possible. A lot of different people will live in a home over time. Today's single family rancher in the suburb will become tomorrow's rental. Today's clapboard 2-story frame house will become tomorrow's fourplex, and so on. So we need to start building with that in mind. And of course, the aging in place kind of movement that's been going on for a while continues. Next slide, please. Also, again, this is mentioned, climate change and disasters. These are going to grow and grow in intensity. So, you know, looking at what happened in Florida, it's not just how big that storm was, it was also the population of people that have moved right onto those delicate coastal areas has increased massively over the years. You know, it also has to do with perhaps new housing codes and building that need to happen to be stronger against these kinds of storms. And again, these are things that tend to affect people of color more significantly, that affect affordability and a number of things there. And this is in the US, all over the country, from the middle to the coast, and it's a global issue. People are going to be moving around and continue to move around in this country and globally over shelter and over habitat destruction and water and so on. And we just really need to get a giant effort here. We talked about unhoused folks. You know, Mary Lou did a great job on that. We really need a new Green Deal, only without the racism in it. And to make up for past mistakes and to get ahead, ADAPT and other groups worked really hard on the Build Back Better bills. We worked really hard with Maxine Waters, for example, on housing, and tried to get some significant stuff done. And it just, we know what happened with that effort. It didn't happen. So we just really need a lot more housing built of all types. And we need to plan ahead and make things strong for the weather that's coming, and, you know, do all these things. It just needs to be, it's a national emergency. Next slide, please. So I wanted to go from kind of looking big picture here to real quick about an important piece that's been around a while that could really, I think it's a doable step. I think it's politically feasible and something that we could get done that would help along the way. It's visitability. It's a concept kind of invented by a woman named Eleanor Smith, a great activist and ADAPT member in Atlanta, Georgia in 1987. This concept developed along principles of affordability, sustainability, and inclusiveness. The idea is to integrate a few core access features into all newly built single-family homes. That was the idea. And these features allow a home to be visited by family, friends, and loved ones. Visitability. Also could allow for short-term occupancy by people with disabilities and to facilitate additional adaptations if they're needed. Next slide, please. So there's three key concepts here: a no-step entrance on an accessible path of travel. And it's got the grades there, 1 to 20 for a sidewalk, 1 to 12 on a ramp. Accessible ground floor hallways and doorways, i.e. 36 inches and 32 inches. Ground floor bathroom, a wheelchair user could enter and close the door. Pretty basic access, but then we can visit each other. Next slide, please. Additional features that were there were reinforcement in the bathroom walls for grab bars, and electrical outlets and switches within easy reach. Next slide. So I'll go through the history really fast. Atlanta first passed the law in '92. Several states and cities followed. By 2014, there were 25. These programs vary widely. Most are mandatory, i.e. Some kind of required standard. But there are also voluntary ones. There's one in Irvine, California that has like 33 options you can pick from and pick none, or you can pick what you want and go from there as kind of a voluntary optional. Most apply only to publicly funded housing, but in Vermont, it applies to all housing. Again, the type of housing covered and the access features vary widely in terms of what visitability means. So for example, in Kansas, visitability covers single family housing, duplexes, and triplexes. But in Texas, the Texas law only covers single family housing and so on. Most of this growth looks like it occurred in the 2000s. And I really think it had to do with, there was a grassroots group very active that spun off from Eleanor's concrete change called the Disability Rights Action Coalition for Housing, or DRAC, who really led the charge. And when they were really organizing, that's when these states and municipalities started passing visitability. Next slide, please. Just the purpose of the DRAC was basically to expand visitability for these reasons. Next slide. So the bill itself, it was first introduced in 2003 by Representative Schakowsky. It's been reintroduced numerous times. The current bills are HR 4695. And you can see it was introduced last year on the Americans with Disabilities Act birthday of July 26th. The Senate bill 4447 was introduced this year on June 22nd, which is the Olmstead U.S. Supreme Court decision around the Americans with Disabilities Act. So those dates are very much on purpose, and you can see how this is very much in keeping really with this whole conversation that we're having. There was a hearing this past May, and in 2010, there was a hearing, and several well-known adapters and independent living, longtime independent living advocates were involved in that, including Eleanor, who the bill is named after. Next slide, please. So the Inclusive Home Design Act now, it generally covers dwellings. The Fair Housing Amendments Act does not. Detached single-family homes, townhouses, whether detached or not, and the ground floor unit in the building with 3 or fewer units. Compliance would be 1 year after passage of the act, and compliance would be required for any kind of federal assistance from HUD, from the Veterans Administration, or from the USDA, and I mean any kind of assistance. Land, reduced pricing, it has quite a comprehensive list to cover every circumstance that federal assistance might be made available, and then that would then cover that. Next slide, please. Here's the visibility requirement. There's actually an ANSI standard 9. It's been waiting on the shelf to be made better use of, and there it sits for us to have. And basically, for the visibility design features, it just incorporates the existing ANSI standards that already exist in terms of, like, again, path of travel, grade, ramp, grade for lavatories and commodes, and so on. Turning radius within the bathroom and that kind of a thing. If the ground floor has a kitchen, then it's got the ANSI for the kitchen switches and controls and so on. So you can take a look at it there. It just needs to be made more widespread. Next slide, please. I'll go through these a little quicker. There's a whole lot on enforcement that assurances have to be submitted to whoever the funding's come from, the VA, HUD, etc. Plans have to be submitted for code compliance and approved. And final occupancy or construction, can be withheld until compliance is met. Next slide. The Attorney General can bring a civil action. There's a private right to action, and the AG can intervene in private actions that appear to be of larger public interest. For liability, if the plan, the blueprint, and so on violates the law, then the state or local agency for code compliance would be liable. If the plans comply, but the construction doesn't, then whoever did the construction would be liable. Next slide. Okay, relief can get actual and punitive damages, different kinds of judges' orders, including temporary and permanent restraining orders. The prevailing party can be awarded attorney's fees. And if there are any compatibility with existing laws, if there are any state or local laws that are just as good or better, they're not invalidated, but it is the minimum standard. And so it will create a minimum standard. If you're doing better than that, then you're fine. Next slide, please. So these will be in the slides that everyone will get, and I just wanted to make sure they were easy to reach links for some of these sources as we go through. And that concludes my presentation.
Awesome. Thank you so much to our speakers today. We have probably time for one question. If there's anything in the chat box, I'm going to have Wendy help with this. But I think some of the questions have already been answered by our panelists. But please feel free to add your questions into the Q&A box or the chat box in Zoom. Please note that we'll send out the recording and the final slides after this event. So please look for the email from Community Living Policy Center for a link that will direct you to all of the materials that were presented today. Any questions, Wendy?
There aren't any in the Q&A or in the chat boxes.
Teresa, hi, it's Mary Lou. I'm wondering if since we don't have a question, if I could just make a quick addition to Mike's presentation.
Sure, yes.
Mike, you mentioned the Section 8 voucher issue and what was going on with the fact that those vouchers weren't used. And I just wanted to say that this may not be the case all over the country, but in California, particularly in the LA area, we have a state prohibition that requires landlords to take Section 8. They may not turn down an applicant who's otherwise qualified if they're using a Section 8 voucher. But in practical terms, that's simply, it's not working. If you look at the ads for apartments or single family homes for rent, you'll see that they say, we accept Section 8, and then you'll see a requirement for a $4,000 security deposit and a 5-year work record and documentation that very likely a lot of people are not going to have available. My organization is in the process of filing complaints with the State Department of Fair Employment and Housing, sort of pointing out these violations. And yet that state agency that is in charge of investigating these complaints is not investigating them because they don't have enough staff. They're asking that the complaints be filed, but they can't actually do anything about the complaint. So we have vouchers available that are unused because landlords illegally won't accept them, which I think is really worth investigating in terms of what kinds of alternative solutions we can come up with to sort of remove that barrier. Thanks.
I'm just looking at the Q&A. Ginny DeMarco commented that people can't find apartments with a Section 8 voucher in Massachusetts either. And John Sorensen was commenting that the requirement exists in many places, but it's not honored. Income discrimination is a huge issue, he says.
Yeah, this is Mike, and yes to all of that. And John, I mean, yes, it's one of the things I even ran into, I think this morning or yesterday, about all the places that, you know, they'll tell you, you have to have an income of X, and nobody on Social Security has that income. I can tell you that, you know, right there. So definitely am seeing that.
Thanks, Mike. Well, thank you, everybody. This brings us to our time. I'm going to close out the webinar. And again, as a reminder, please look out for a follow-up email from the CLPC for all resources and links used today. Thank you so much and have a good day.